Hello, I'm Veronica Campbell of Integrated Manual Physical Therapy. This video is to help you learn how to treat your vagus nerve from a mechanical perspective in relationship to where it travels in the neck. And remember, we have a right and a left vagus nerve, and it has a tremendous amount of anastomosis, so communication with a lot of other nerves and fascial connections in this area. So the first video is to show you a little bit of an anatomy journey of this area so you understand what you're trying to decrease pressure on or decompress and free up. Again, when you're doing these techniques, please be very gentle. None of this should ever be painful. So enjoy the anatomy, and then the hands-on technique will be demonstrated after that. If you have any questions, always feel free to reach out. Thanks. This is for learning purposes for you to just have a little bit of a visualization of what your anterior neck or the front of your neck muscles are protecting, and that if there's compression and tension in the front of your neck, especially behind the sternocleidomastoid and all the fascial layers, that there could be compression on the jugular vein, the carotid artery, the vagus nerve, the esophagus, the trachea. So blood flow to and from the brain and communication to our body from the brain all can be compressed. And if you have a technique that can gently free up the fascia of this area, especially vascular and neural communication, you could potentially really help your autonomic nervous system regulate a little bit better. So the techniques that I'll be showing for this are geared towards freeing up the fascia off of these anatomical structures. Hello, this is Veronica Campbell from Integrated Manual Physical Therapy. This video is geared for our patients to be able to teach you a self-care technique that can help with the front of the neck, the fascial layers that can be affecting the vascular to and from the brain, as well as the vagus nerve and the throat fascia, specifically around the esophagus and trachea. So these fascial layers are called visceral fascial layers, vascular fascial layers, and they all overlap in this area. And so much of our time now is spent looking down at our phones with a forward head driving or at your computer that this area can become tremendously tight. And with the tension in this tissue, it can affect your vagus nerve. And we think about vagal stimulation in terms of regulating the nervous system with vagal nerve stimulators or other breath work and techniques. But what about a hands-on technique that can help treat the mechanical tension over the vagus nerve? And this area was recently found in research to have a lot of tension in it on ultrasound, so fascial thickening in post-COVID, long COVID patients. And so that idea of tension in here related to COVID could be part of it, but also from postural habits and things like that as well. So just to give you an idea where we're targeting, we have fascia, there's many layers here, and muscular layers as well. Fascia is the layers between. But if we can look at, and you can see here nicely, this is called my sternocleidomastoid. So I have an SCM on each side. And the SCM, sternocleidomastoid, behind it is the layers of the vagus nerve, carotid artery, and jugular vein. So I think of the SCM as kind of like this bodyguard, but it can also kind of hug it a little too tight sometimes. And so if you can get behind this fascia and lift it off while adding gentle movement, breath, and other things, you have the potential to decompress some of this tension. And so the idea here is if you can tip your head and get your fingers, palm facing forward, behind the SCM on each side, your pinkies can be all the way up to where you feel the base of your skull, and your index finger can be all the way down, almost to your clavicle, depending on how wide you can spread your fingers. And then what you want to do is very gently sink in until you feel the bone, but you shouldn't have pain. You shouldn't feel like you're compressing a pulse or anything like that. This is very gentle. And once you feel like you have your fingers in the right place, you can start to bring that tissue forward. So once my fingers are gently in, I can play with bringing that tissue forward. So I'm lifting it off. I can also play with sliding it up and down, but the idea is to get behind this and gently lift it off. Once you feel like you have a good perch and hold, and it's gentle, you're not provoking any pain, then you can play with a deep breath and gently lifting a little more, or what I really like is head nodding. So you can do that, a swallow, which I just did. Because you're affecting the tracheal layers, the esophageal layers, even the thyroid fascia, and then of course the neurovascular fascia. So gently lifting. You can also play with side bending. You can play with rotation. But all of these different layers are interwoven, and if you very gently lift them, you can decompress potentially the vagus nerve a little bit. You can also go in and check the skin and see where the skin is tight on the front of your neck. And anywhere you feel a little bit of tension, keep in mind we have a right and left vagus nerve and neurovascular sheath in here. You can affect that through the skin because there's a lot of shared communication through the nerves. So say, for example, you get a layer of the skin, you can lift it off and test how well does it slide up and down. Down is tighter, up is easier. How well does it slide forward and back? Back is easier, forward was tighter. So I can play with stacking it into ease. So I'm going to go back and up and then just take a few breaths and let that tissue soften. I can add a little movement. I can also, if you can't see this completely, I can be on it lifting. It's gentle. I can stretch it apart. I can add little twists. Anything to start to play with that tension, taking it into ease first. And then once it starts to soften, then maybe taking it into a little bit of stretch. Then maybe adding a little more stretch and adding a little more movement and breath and nodding. And I sort of like that gliding and flossing idea with this tissue to help decompress as well. So there are a couple techniques to help this area. There's also an anatomy video I've made to link with it so you can see what you're working with. And if you have any questions, feel free to reach out.